Hello everyone, and welcome back to my channel. I am Dr. Healthy. Today, we're going to talk about something that affects so many of us, particularly as we reach our 60s and beyond, and that is high blood pressure or hypertension. It is often called the silent killer. For a good reason, you often don't even know you have it. Yet it's a significant driver of kidney failure, strokes, heart attacks, and even dementia. It's a big deal. We often hear it referred to as essential hypertension, which, in a way, is the medical community's admission that for a long time we didn't fully understand its root causes. But we do now, and the truly empowering part is that many of these root causes are entirely treatable. So, what's the biggest factor contributing to high blood pressure? By far, it's insulin resistance, often a precursor to prediabetes. The statistics are startling. Recent data reveals that a staggering 93% of American adults either have high blood pressure, high cholesterol, high blood sugar, have experienced a heart attack or stroke, or are overweight. This means that only about 6.8% of American adults are truly free from these common health issues. That's a concerning reality, isn't it? Why is this happening? It's largely due to our diet. We consume an immense amount of sugar and refined flour, creating an inflammatory environment and high levels of oxidative stress in our bodies. High blood pressure is, at its core, a condition driven by inflammation and oxidative stress. And what is often the trigger for this? It's insulin resistance, which is fueled by the mountains of sugar and refined flour we consume daily. The average American now consumes nearly a pound of sugar and 133 pounds of flour per year. That's almost a pound a day. This relentless intake fuels metabolic dysfunction, leads to increased organ fat, and sets off a cascade of events that drive up blood pressure and contribute to weight gain. Addressing these root causes is absolutely critical. Of course, other factors can contribute. Heavy metal toxicity, often undiagnosed, can play a significant role. Sleep apnea is another major contributor. If you snore heavily at night, it could be directly impacting your blood pressure. Nutritional deficiencies, particularly in omega-3 fatty acids, which over 90% of the population are deficient in, and magnesium, affecting about half the population, can also be significant factors. And let's not forget stress, lack of exercise, and exposure to certain environmental toxins. Worldwide, it is estimated that nearly a quarter of the adult population has high blood pressure. Many more have prehypertension, which is an early warning sign. While we often hear about blood pressure targets like 140/90ths mmHg, even at levels like 120/80ths mmHg, there's still some risk. Ideally, we want our blood pressure to be below 110/70ths mmHg. Unfortunately, due to our modern lifestyles, our inflammatory diets, the stresses of our environment, lack of exercise, and the sheer volume of inflammatory triggers, most of us do not achieve these optimal levels. The conventional approach to managing high blood pressure often involves medications, sometimes combinations of them. While these can help reduce the risk of complications like kidney failure and stroke, they rarely address the root cause. This is where functional medicine, and indeed the health doctor, focuses on uncovering and treating the underlying reasons for the problem. The salt question. A misunderstood factor, a common piece of advice for lowering blood pressure is to drastically reduce salt intake. But is this always the right approach, or is it another area of misinformation? We need salt for survival. In fact, since our hunter-gatherer days, our ideal ratio of potassium to sodium has flipped. We used to consume roughly 10 times more potassium than sodium salt, but today it is closer to 10 times more sodium than potassium. Potassium is a vital mineral that helps to lower blood pressure, and it is primarily found in plant foods. When you eat a diet rich in whole, unprocessed plant foods, you get plenty of potassium. Conversely, processed foods, which often use a lot of salt to make refined oils, flours, and sugars palatable, lead to high sodium intake. So it's not the salt you might sprinkle on your food after cooking. That's the main issue. It is the hidden salt added by corporations in processed foods. If you enjoy a little salt on your food, don't worry too much, especially if you're consuming a whole foods diet. In fact, adding salt towards the end of cooking can enhance flavor and may allow you to use less overall. However, it is crucial to increase your intake of potassium, rich plant foods dramatically. Think spinach, broccoli, squash, avocados, papayas, and bananas. Making a potassium broth by boiling root vegetables and greens and then straining it is another excellent way to boost your potassium intake. There are certain individuals, genetically predisposed, who are salt sensitive and may need to restrict their salt intake more rigorously. But for the majority of us, the real problem isn't the salt we add, but the lack of potassium and the abundance of processed foods. In some studies of heart failure patients, those who severely restricted salt intake were actually 85% more likely to die or be hospitalized than those who did not limit their salt intake. This highlights that a blanket recommendation to cut salt may not be universally beneficial, especially when combined with a whole food diet. Addressing inflammation and oxidative stress, the true drivers, the real key to lowering blood pressure, lies in reducing inflammation and oxidative stress. And how do we do that? By getting rid of the junk food, all the processed foods. Embrace instead a whole food plant rich diet that is high in potassium. Rich foods. I developed a 10-day detox diet as a simple, effective way to cut out inflammatory processed foods. We've seen people experience blood pressure drops of up to 20 points within just a week or 10 days of following this plan. The results can be incredibly impressive. Focus on potassium-rich foods, as mentioned. Broths, fruits, vegetables, nuts, seeds, and legumes are excellent sources. High fiber intake helps improve insulin resistance. Healthy fats, omega-3 fats, are particularly important for reducing inflammation and can also help lower blood pressure. Good sources include wild fatty fish like sardines, mackerel, herring, anchovies, and salmon. Grass-fed meats like bison and lamb also tend to have a better omega-3 profile. The key is to eat real food and eliminate processed options. Calcium and magnesium. Magnesium is a vital mineral for blood pressure regulation. It acts as a relaxation mineral. In fact, in cases of preeclampsia, pregnancy, induced high blood pressure condition that can cause seizures, intravenous magnesium is the primary treatment. It makes you wonder why we don't start with magnesium for everyone with high blood pressure. You can get ample magnesium from leafy greens, beans, seeds, and even a little from dark chocolate. Carbohydrates. The primary issue is with refined carbohydrates, starches, and sugars. While we should cut those down or eliminate them, focusing on good carbohydrates, which are found in all the fruits and vegetables, is essential. Sugar, in particular, is a major driver of the insulin resistance that fuels high blood pressure. Protein and fat for breakfast. Many American breakfasts consist of cereals, bagels, muffins, and pastries, all high in sugar and refined carbs. This is dangerous. For breakfast, prioritize protein and healthy fats. Consider a protein shake, eggs, avocados, or flax seeds. Lifestyle interventions. Exercise, stress, and sleep beyond diet. Several lifestyle factors play a crucial role. Exercise. While exercise can temporarily increase blood pressure during the activity itself, it significantly improves your cardiovascular system and lowers blood pressure in the long run. It's also critical for weight management, and even losing just 5 to 10 pounds can have a substantial impact on blood pressure. Exercise is not a luxury. It's an essential component of living, just like eating and breathing. Ask yourself, would you rather dedicate an hour a day to exercise or face the prospect of being dead 24 hours a day? The choice is clear. Stress management. Stress is a significant factor that drives blood pressure up. The stress response releases adrenaline and cortisol, both of which elevate blood pressure. Practices like yoga, tai chi, meditation, guided imagery, and breath work activate your parasympathetic nervous system, your rest and digest mode. This helps to counteract the stress response, lower blood pressure, reduce inflammation, and improve your metabolism. Sleep. Adequate quality sleep is paramount. Sleep deprivation can directly contribute to high blood pressure. To improve sleep, maintain a consistent sleep-wake schedule, even on weekends. Reserve your bedroom strictly for sleep and intimacy, avoiding work or watching television in bed. Ensure your bedroom is dark, quiet, and cool. Get morning sunlight exposure, about 20 minutes, to help regulate your body's natural melatonin cycle. Avoid eating or engaging in intense exercise close to bedtime. If you struggle with racing thoughts, try writing down your worries before bed. Consider a warm bath, massage, or gentle stretching to relax. Be aware of medications that can disrupt sleep, such as antihistamines, stimulants, cold medicines, steroids, and those containing caffeine. Helpful supplements and supportive measures. If you implement these dietary and lifestyle changes and still need a little extra support, several supplements can be very helpful. Magnesium. As mentioned, it's crucial for relaxation and blood pressure regulation. Citrate or glycinate are good options. Coenzyme Q10, CoQ10. Studies have shown it can help with blood pressure. Potassium, essential for balancing sodium and for healthy blood pressure. Omega-3 fatty acids for their anti-inflammatory benefits and direct impact on blood pressure. B vitamins. Support overall metabolic function. Extra fiber to improve insulin sensitivity. A good quality multivitamin to ensure a broad spectrum of essential nutrients. Taking control of your blood pressure by following these principles. Eliminating processed foods, eating potassium, rich whole foods, managing insulin resistance, reducing inflammation and oxidative stress. Getting enough magnesium and omega-3s. Managing stress, prioritizing sleep, and exercising regularly. You can significantly improve and often resolve high blood pressure. For individuals with more complex issues, such as advanced vascular disease or heavy metal toxicity, medical intervention might still be necessary. However, for many, addressing these root causes through lifestyle changes can be far more effective and sustainable than relying solely on medication. Remember, the guidelines from organizations like the American Heart Association emphasize a lifestyle-first approach. Try these strategies. I'm confident you'll see remarkable improvements, and you may find you don't need medication at all, or can significantly reduce the dosage. If you found this information helpful, be sure to check out my other videos and resources on the Health Doctor channel and website. We're here to empower you with the knowledge to take control of your health and live your best life, especially in your vibrant 60s and beyond.